Is it safe to exercise when you've got back pain? Can you lift weights? What kind of exercises can you do? Well, we'll try and unravel some of that during this video. I'm Anthony Gosh from the Spine MDT. Please hit the subscribe button to stay posted with videos I post every week on back pain, spine care. Also head over to the blog page on my website where videos and blog posts are frequently posted about spine disease and spine care. None of what I'm going to tell you right now is a substitute for being assessed by a healthcare professional or indeed a spine surgeon. It's just a general guide. A lot of this comes down to the cause of the pain in your back. In chronic lower back pain that's been there for quite some time that you've been managing, all of the evidence is quite clear. The worst thing you can do for a bad back is sit on the couch all day and lie around, and I often say that. So actually doing some exercise is good for you. The more you move around, the better. In more acute lower back pain, i.e. pain that has started quite recently, it's important to be assessed by a healthcare professional to make sure there's nothing sinister underlying that. Most of the time it isn't. It's usually muscular or down to degenerative change, a posh word for wear and tear of the spine, in which case, again, the exercise is generally good, but you've got to listen to your body to some degree. So things like running and walking are okay. People often talk about high impact exercises such as running on hard ground. That impact can cause damage and wear and tear over time. I think there's a bit of a myth behind that personally. We know definitely not exercising, putting on weight, lying around is definitely worse for your back. Sitting stationary at a desk all day is bad for your back. Doing some exercise to get things moving, including running, is actually okay for your back. Doing it on softer ground is better. On a treadmill where you've got an even surface for your steps, it is a good way to go. I often get asked about weightlifting with back pain. Well, again, if some of the weights that you're using and the movements you're doing target the lower back muscle to help strengthen them, it's actually okay to do so. So let's go through them. Things like, I often get asked about barbell squats where you're vertically loading the spine. Yes, there's got to be some caution. So what I say, during a period of back pain, lower the weight to what you normally use. Start off with a very light weight and just make sure you're getting the movement itself right. Once you've mastered that, then you can slightly increase the weight and keep going from there. This sort of exercise here does actually improve, although it's working your quads and your glutes and hamstrings, it does actually target the lower back muscles as well, which can help with the long-term treatment of back pain. In fact, where to be cautious is if you have a slip disc and sciatica pain shooting down the leg. Sometimes this vertical loading can push the disc out further, so be a bit cautious with that. Things to generally be careful with are a leg press. So that's why for targeting those muscles, I prefer patients to actually do the back squat, where you're actually learning how to stabilize your body when doing the movement. And there's some evidence suggesting that the back squat is actually better for that. And again, the help of a physiotherapist or even a personal trainer with this is really useful. Some myths around deadlifts being bad for your back. That's actually not true. Provided you use the correct form and do the exercise correctly, it's one of the best exercise for the lower back. Again, you've got to be cautious with the amount of weight you're lifting. If you're going through a period of acute back pain, listen to your body. If the process of picking up the weight is hurting you, then obviously don't or lower the weight, especially if you've got sciatica again, if you've got pain shooting down the leg. And again, I can't emphasize the importance of working with a personal trainer to make sure you're using the correct form. So once again, lower the weight, even use the bar itself just to make sure that you've got the correct motion, the correct form, and then start adding the weight. Building up the abdominal muscles is an important part of your core strengthening program to protect your spine. But what I'd say is be a bit cautious in an acute period with sit-ups and crunches, especially if you're experiencing some sciatica. That's because this is the spine here. It is its normal alignment. That's the front and that's the back. Motions that curve this forward, that reverse this curve, such as a crunch, can push the disc further out. And on this view here, it will pinch the nerve and worsen the pain, worsen the prolapse, something you've got to be careful. So to target those muscles instead during a period of back pain or acute back pain, I prefer exercises such as a plank. There are variations to this. There are more sort of dynamic planks where you can lift one leg up at a time. That does help with some rotational stability of the spine. And then you've also got side planks as well. This is shown here. That targets some of the more oblique muscles. And another good exercise to target the lower back muscles, the glute and the hamstrings, which will kind of make up the core as well, are bridges, and there are variations of this. So provided certain conditions have been ruled out, like a large disc prolapse, compressing nerves in your spine, a pathological fracture, and other stuff ruled out by a healthcare professional, a spine surgeon, or a good physiotherapist, then it is safe to do all of these exercises. I'd say start off with the non-weighted exercises that have just been shown, and then start adding the weight ones, and listen to your body. Don't overdo it. If you're starting to feel pain with these motions that's getting worse, then obviously stop. Start off with the lighter weight, so drop the amount of weight that you normally use. Make sure you've got the motion correct, and then gradually build up. I can't emphasize the importance of working with a personal trainer or even a good physiotherapist that can show you the movement. So the goal of the Spine MDT is to find the least invasive solution that gives you the longest lasting result for your spine condition. And we can do that by working in a whole network team of all professions of spine care, spine surgeons, pain specialists, physiotherapists, osteopaths and chiropractors, all working together to achieve that goal. There's a link below for the website, the blog page. You can call us or email us, and we'll be very happy to help you. Thank you.